Today, after COVID-19, we are extremely aware of the importance of health communication. In this video, we're going to talk about health communication with caregivers, health and social support, and media messages related to health. So let's get started by talking about caregivers. Caregivers can be professional caregivers such as doctors, nurses, physical therapists that are paid to provide healthcare services. Most professional caregivers spend time getting trained and being certified before they can deal with the general public. They're also normally regulated by the state and federal governments. On the other hand, there are different types of volunteer caregivers. These are usually family, friends, maybe church members or other organization members that help with healthcare. In order to receive the best care, whether it be from a professional or voluntary care worker, it's important that there's good communication and exchange of information, both to the patient and to the caregiver. The first thing patients need is they need information about what's going on with them. They need ways to find out the right thing to do. This could be from their healthcare provider directly. It also could be from online sources or information that's given to them. Patients also want certainty. They want to know what's wrong with them. They want a diagnosis that says what the problem is, and then they want a prognosis. How much time is it going to take them to get better? How long do they have to take medicine? How and when will their life improve? Patients also want privacy and confidentiality. They want their information maintained in a way that it won't be accidentally shared with others or penalize them in some way. They also want confidentiality between their doctor. They don't want the doctor to share the information in ways that they're not comfortable sharing it. Caregivers, on the other hand, need communication too. They need good, clear, honest, transparent communication from the patient. In order to do their job well, they need this information. And in fact, it can be dangerous if critical information is not communicated. Caregivers also need efficiency. In our society today, many caregivers are working at a very busy, time-pressured pace, so they need the information quickly and easily available. One skill that caregivers need to possess is empathy. They need to be able to empathize with their patients and understand the situation that they're in. Research shows that doctors who are more empathetic and paraphrase their patients are less likely to be sued for malpractice. Caregivers also need your cooperation. They need for you to take and do what they recommend that you do. Research here shows that healthcare professionals can have an impact on how likely we are to provide their prescribed treatment. Research shows that healthcare providers with a warm, open immediacy behaviors versus cold immediacy behaviors are more likely to have patients comply with their requests. This is partly because patients feel more open asking questions when they need clarification. Increasingly, media and health communication go together. Telemedicine combines the use of the media and the doctor to go to the doctor without leaving your home. In the wake of COVID-19, we've seen a huge surgence of this type of doctor's visit and its benefits to us in a crisis situation. We also get a great deal of our health-related news from the media. We research it on sites like WebMD if we have something wrong with us to try to diagnose ourselves. We hear about public threats through the news media such as COVID or Zika or Ebola. We hear health messages from the CDC or American Cancer Association encouraging us to adopt or stop certain behaviors. One concern related to the media's reporting related to health is their tendency to over-dramatize or sensationalize events. This can lead to crises and scares on the part of the public. There are many watchdog groups that now look for this type of behavior. A controversial, more new type of media health message is pharmaceutical companies advertising their drugs directly to the public. The companies argue that this gives consumers more knowledge of their choices and allows them to collaborate with their doctors more on their treatment. However, there's great concern over the impact this is having to overall drug cost, and that what is advertised are very expensive treatments, and that it's driving up the cost of drugs for the country. It's also causing pharmaceutical companies to spend more and more money on advertising, which also drives up the cost of prescription medications. The other criticism of this type of advertising is that it often doesn't depict realistic images of people with the conditions. For example, one recent arthritis ad projected an individual doing physical activities that 93% of the users of the product could not do. Critics argue that this is a common practice in these types of commercials, and that it's a practice that should be ceased. There are some positive impacts of media on health. Studies have shown that shows like Grey's Anatomy increase people's awareness and make them more likely to take action with health concerns. However, there are two sides to that coin, in that some diseases are made more prominent than they really are, and there's definitely some dramatization of the health situations. On the internet, there's also a great deal of health information, but this information requires the searcher to be particular. So they need to stick to credible sites such as WebMD and the Mayo Clinic, and avoid other less reputable sites. The media has also been shown to cause issues relative to health around body image. We're all aware of the perfect body images that we see both for men and women on TV, and that they don't reflect the general population in the United States. These body image issues end up leading to diseases such as anorexia, bulimia, and even steroid use among men. Another area where media can improve is their representations of sexual health. Only 1 in 25 sexual images on TV refer to any type of message of health related to condom use or birth control. Because we know media has an influence, by putting in healthy communication examples, this could help young people broach conversations about safe sex and how to avoid pregnancy. One way that the media can be used positively is through health campaigns. These are campaigns that use the media to encourage people to adopt healthier behaviors. One common example of these are the smoking cessation campaigns. Health campaigns require a great deal of persuasion, but health researchers have debated over what's the right approach of persuasion to get people to change behavior related to their health. Therefore, researchers have come up with different models or theories about how to persuade people with health campaigns. I'm going to talk about a few of them here. The first model is the healthy belief model. And in this model, an individual believes that if they don't change their behavior, they're going to suffer considerable adverse effects. They also believe that it's worth the cost and effort to make the change. And usually something has impelled them or happened that causes them to change, like a major health episode or a near brush with death. The next model is the cognitive and environmental model. And it basically says that people change when their cognitive beliefs and the environmental factors that support that change will happen. For example, we have to cognitively or brain-wise know that something's good for us, and then we also have to have an easy way to do it. So, for example, if I want to jog every day, I'm more likely to jog outside if the weather's good and cool versus if it's hot and muggy or raining. The cognitive, what I think is good for me, lines up with the environment of the nice weather. The next theory of how to persuade individuals regarding their health is the theory of reasoned action. And this basically says that people make rational, deliberate decisions about their health behaviors. According to this theory, the strongest predictor of engaging in a specific behavior is your intention or decision to perform that behavior. There's two factors that influence your intention: your attitudes about the behavior, and then your perceptions of the social norms around performing the behavior. Another theory is the theory of planned behavior. And this theory basically says that a person must have an intention to change and believe that they have the ability, skills, or resources to change. This theory argues that someone can intend to make a change, but if they don't know how to do the behavior or they can't afford the behavior, they won't follow through on the intention. So you must have the intention and the means of going forward with the behavior to change. The final model that we'll discuss here is the trans-theoretical model. And it argues that people don't change right away, even when they know they need to change, that instead they do so in stages. The trans-theoretical model has 5 specific changes that it argues someone goes through before they make a change. The first stage is pre-contemplation, and that's when people aren't even aware they need to make a change. The second stage is contemplation, when they begin to think about the reasons for the change. Then there's preparation, when they decide to take action. Then there's action, when they actually change the behavior. And then maintenance, when they keep up the behavior change for at least 6 months. You can see how each of these models might have a different impact on how you ultimately decide your campaign. These also interact with the actual issue that you're going to be discussing. So in some situations, one model may be better than the other, depending on what all the communication elements behind your communication are. Before we leave today, the one thing that I would like to discuss are the types of appeals that are used in health campaigns. The first type of appeal that's used is the logical appeal, and these rely on regular logical thinking of people. They point out cause and effect relationships between behaviors and health outcomes. For example, like drinking while pregnant causes severe birth defects. The purpose of these appeals is to give people the information they need to make those rational decisions about their health. The next type of appeal is a positive effect appeal. And this is basically using positive, happy emotion to encourage behavior change. You attempt to make people feel good about adopting the recommended behavior. Some do so by making the message entertaining, pleasant, humorous, have attractive models, and they even also do it by focusing on the positives that are going to happen in your life. The final type of appeal is the negative effect appeal. And this is when it uses negative emotion to influence you. So it tries to make you feel anxious, guilty, or fearful if you don't adopt the recommended change. So it makes you feel unpleasant. It makes you motivated to reduce that unpleasant. These campaigns can make people feel ashamed of their poor health or anxious about the health risk. One item of note on negative effect appeals is whether you target the individual or the loved ones near them. The research shows that people are more likely to change when it's going to have negative impacts on their loved ones than when it's going to impact them directly. So, for example, in smoking cessation programs, it's been discovered that you're more likely to get the smoker to stop smoking because of the impact of secondhand smoke on their loved ones than the impact of smoking on themselves. Health campaigns are complicated. You have to clearly think about what your goal is. You have to clearly think about who the audience is and how you reach that audience, and what different channels are most effective for delivering your message. Then, once you've made those decisions, you need to actually design your message, test your message, implement your message, and then evaluate its effectiveness. These are major strategic communication efforts that require a lot of thought and knowledge and require a communication expert. And at this point, you should be beginning to see how complicated being a communication expert is. This is one of the close to, if not the last lecture in this course. I hope you've enjoyed it, and I will see you when I see you.